Hey, and welcome to Of Idiots and Intellects. I'm here today, pretty much as always, with Cody.
So,
how deep can you make your voice? Do it. That sounded like a burp.
You're right, that did sound like a burp. I don't know. I don't know what to say now to try and do the low voice.
This is a low voice.
This is as low as I can get.
Jesus Christ.
I know a lot of people get freaked out when I use my low voice, especially when I sing, because I have such a higher pitch.
Yeah,
when I talk and sing.
that was borderline demonic.
Well, who knows? Maybe I'm possessed.
That puts a lot of pieces in place.
I'm offended by that.
Good, be offended.
Just because I'm slightly crazy and love the spooky things.
Spooky. Shut up.
Shut up. Everybody just shut up.
Everything's fine. So today we're going to be talking about kind of a pretty serious thing, actually. I know that it doesn't seem that way with our low voice intro. But we are going to be talking about dissociative identity disorder.
Yes.
So it used to be called multiple personality disorder, but it's essentially when someone switches between different identities, but it's way more complex than that, and it's
right. That's the easiest
really
explanation of it.
Yeah, and that doesn't even do any justice.
No, absolutely not.
It's a super fascinating topic. I'm really excited.
This was always my favorite topic to get to in any of my psych classes that I took.
Yeah, it gets super intense too. This is actually going to end up being a 2-part episode because we just have so much stuff, and we actually have an interview with someone who actually has DID, so that's going to be pretty cool. I'm just so excited for this episode.
I am too.
It's going to
be a really good one.
Yeah. So definitely, sorry, I kicked you.
How dare you?
You know what? I'm not sorry.
That's rude.
I'm glad I did it. I'll do it again.
Don't make me pull my demonic voice out again.
No. So dissociative identity disorder, as I said previously known as multiple personality disorder, is a complex psychological condition that is pretty much always caused by severe trauma during early childhood. When a person develops a number of identities or parts or alters, there's a lot of different terms for the same thing, because I think partly because it's a weird thing to describe.
Right.
You know, it's hard to understand looking in from the outside. But anyways, when a person develops a number of identities all housed within a single body, that person is said to have multiple personalities. And they're all very distinct.
Right.
Which is one of the most interesting parts. They're so separate from each other.
Right. And not that... And a lot of people who haven't taken a lot of psychology classes or in the medical field and stuff like that, they just assume that the dissociative identity disorder is just its own thing. When really it's under this giant umbrella of just dissociative disorders where you dissociate yourself from the world in multiple different forms.
Yeah, there's more forms than just developing multiple identities. So.
Which I just wanted to make clear because that's a lot of misunderstanding that a lot of people have with that.
Which I didn't know that, and I've been kind of researching these topics for years. So it's not like a well-known thing, but it is an important thing to know. And some people even doubt the existence of DID, multiple personalities. Some people think that it's a form of schizophrenia. Some people just think that the person is acting, trying to get attention. I think some people take advantage of the existence of this disorder, and then they'll act out like, I have multiple personalities, but you don't, you dumb bitch. You're just, you're just acting to get attention. But it is, personally, I think it's very real.
Oh, absolutely.
Yeah, there's no doubt about it. Yeah. So, hello? Big time stutters. Yeah. Action. Dissociative identity disorder is a severe form of dissociation which is a mental process that produces a lack of connection to a person's thoughts, memories, feelings, actions, and or their literal sense of identity. And like I said, it can stem from a combination of factors, but trauma being experienced, especially at a young age, is the most prominent cause. Roughly 99% of individuals who develop dissociative disorders have recognized personal histories of reoccurring, overpowering, and kind of often life-threatening disturbances or traumas at such a sensitive, crucial developmental stage in childhood, usually before the age of like 6 years old. Mm-hmm. So just let that sink in. That's pretty intense to have to go through such intense trauma before age 6.
Right.
I would try to find a way to get out of it too.
Oh, absolutely.
And that's essentially what dissociation is. It's like a mental escape from reality. It's pretty intense.
Even like a lot of people with PTSD from like going to war and stuff like that at points develop, end up developing the DID.
Yeah, because I mean war is
scary.
War, man.
Yeah.
So yeah, it's essentially an escape, and children, I mean, obviously they can be physically, emotionally, and sexually abused, neglected, or abandoned, or a combination if you're really that unlucky. So they can't understand what's happening in these situations because they're just kids. And so they'll try to understand what they did wrong or why the abuse or neglect is happening. The truth is, a lot of people just aren't fit to be parents or caregivers.
Right.
Like, obviously the kid did nothing wrong. They were just born into an unfortunate situation where people weren't fit to be parents.
Right.
And that sucks. But it happens a lot. So, obviously it hurt. I mean, do you like being sad or fearful or angry?
No, absolutely not.
You're angry all the time, though.
That's because I work customer service retail. So I'm mad all the time.
Forgiven. You just dissociate into, like, a customer service person and then you.
Honestly, though.
Your customer service voice is killer. Okay, anyways. That's not real dissociation, by the way. But, so, it doesn't feel good to have those negative feelings, sadness, fear, anger. So kids will look for relief in literally any form available to them. And usually the only way that they can find relief is internally.
Right.
Where they just block everything and dissociate. So they essentially try to push out all of their feelings, but to survive, most children do develop dissociation patterns if they're going through traumatic situations. Not all children, just to make it clear. Just these
abusive ones.
Poor...
abused ones.
Yeah. It's bumming me out. It's bumming me out. Because that's...
This is why we did my doppelganger one first, because this one's going to be so serious.
Yeah. I want to make jokes, but nothing's funny. So, dissociation is a coping mechanism. The person literally shuts off or dissociates themselves from a situation or experience that is too violent, traumatic, or hurtful to assimilate with their conscious self. Dissociation can be very useful in terms of surviving because it allows an individual to mentally escape a terrible situation. And the body and mind kind of seem to separate in a way. But not everyone dissociates in the same way, and I think that's important as well. Do you have anything to add for that?
At that part, no.
Okay. So people aren't born with multiples or alters or separate identities. They're all the same thing. So just to define alter, an alter, when someone says, oh, well, my alter, that's a separate personality. Mm-hmm. Not everyone kind of makes the connection where, like, this identity is an alter, this identity is a different alter. An identity and alter are interchangeable. You knew that. You did the research.
But a lot of times people get that confused with just, like, the whole, like, quote-unquote, two-face situation.
Yeah. Mm-hmm.
And just being like, oh, well, that's just a different, like, attitude that they always have around certain people.
Yeah, it's just a different personality trait.
Yeah, that.
Yeah, and it's not. It's an entirely different identity. Different alters.
Mentality, even.
Yeah. Yeah, no, and it's so intense because different alters or identities. I'm trying to, like, figure out which one I want to say, but I just keep saying both.
I mean...
Everything's fine. It's fine. Help.
I mean, between at least, like, alters and multiples, like, kind of similar, same thing in a sense.
Yeah. Well, okay, so each alter has a very specific behavior and mood, like you said, because they are an entire separate identity. Mm-hmm. But these alters don't change over time, kind of like how a person grows through age, whatever. Alters don't change. And that's pretty important. Also, alters can be various ages, different genders. If woman has DID, she can have multiple male alters, child alters, it doesn't matter.
There was one research thing that I found also, that I actually found a couple different times, so, which is why I'm going to bring it up, is that it's been found that some people with that do have animal alters.
Yeah.
Of, like, cats, dogs, farm animals, stuff like that. Mm-hmm. Which is interesting.
I think that's going to be a good chunk in part 2, maybe. Because that, part 1, we're going to go through, define everything, and speak with someone who has DID. Then part 2, we're going to get into the real, like, extreme, intense, super, super intense situations where, like, all of a sudden someone can speak a different language. Right. Or one of... the alters is diabetic and needs insulin to survive when the rest don't. Crazy stuff. So,
and just a couple different theories behind it. Also that, like, doctors and stuff have, like, come up with.
So, just both parts are going to be so in-depth. I'm so excited. So, we are going to take a quick break. I really have to pee again. I had to pee so bad during the first part of the doppelganger episode that we did for Cody's podcast. I have to pee again. I have to pee so bad.
You have such a small bladder.
I don't know what it is. I drank like 4 bottles of water in the last 12 hours, so I think that might be it.
Possibly.
But I feel like that's pretty average, right? No? I don't know.
I mean, average is like, what, 8 to 16 cups of water? Cups, so, I mean, bottle-wise. Maybe. I don't know. Anyways, when we come back, we are going to be interviewing someone who has DID, and it is someone that is not new to the podcast because it is my mother. So... I love Brenda.
Brenda's awesome. So we're going to be talking with her. I'm not sure exactly how personal it's going to get. I'm not sure how nitty-gritty it's going to get.
So, potential disclaimer already put on.
Yes.
At this point, like...
It can be a really emotional thing. Personally, for me, I love it, so I'm ready. Okay, So we're going to take a quick break. I'm going to pee, and we'll be back with my mom. Okay, see you in a minute.
Bye.
All right, welcome back, and welcome to my mother.
Hello.
So let's just get into some of the history, right? What stories do you have?
Well, there are stories back, like, in the late 1800s. There was a woman that was first diagnosed in 1811 by the name of Mary Reynolds. But then with further research,
stop clicking your pen.
There was a German woman in 1791 who began speaking French. She was never taught the language. She would then have her German yet with a French accent, and she had no recollection of the French part of her whatsoever.
Yeah, and we'll talk more in depth about that kind of thing in part 2 as well, because that's... Part 2 is going to be pretty intense.
Yeah.
It's had different names, too. It was first called hysteroepilepsy.
Oh, you have that.
I do. I have a bunch of stuff on that.
Yeah.
Then it was changed to Multiple Personality Disorder, and then it's been changed to Dissociative Identity Disorder.
So tell us about the... whatchamacallit? What's it called?
The hysteroepilepsy?
Yeah.
My notes that I found, it dates back to the early 19th century. It displays compelling evidence that the human psyche is constantly active in producing personal units of perception and action that might be needed to deal with the challenges of life. Mm-hmm. So the whole just dissociating yourself sort of situation. Dr. Jean Martin Charcot? Charcot? I don't know. Charcot. So that could be pronounced 12 different ways.
Sure.
Who was chief physician at Salpid. Oh my god, these words. Well, it's
words.
French, so I guess it's a French name, French place. Chief physician at Salpêtrière Hospital in Paris discovered the disease, and they ended up calling it hysteroepilepsy, obviously combining both symptoms of hysteria and epilepsy. Mm-hmm. And some of the first symptoms discovered with it were contortions, convulsions, fainting, and impaired consciousness.
Oh, all right.
One of the first patients that had the disease was put in the first patients that had the disease were put in general wards of the hospital while still being separated from each other. Mm-hmm. And this treatment was very effective as far as reducing the symptoms, but not curing it.
Yeah.
They use things along the lines of electroshock therapy as their biggest thing trying to fix this.
They still use that today.
Yeah.
Do they?
Yes.
That doesn't make sense. I mean, what's...
The point of it is to try to erase long-term memories and flashbacks, but when it comes to DID.
Right, if the identities are already developed in the behavior
For
patterns.
some people it works, for some people it works temporarily, and for some people it doesn't work at all.
Yeah.
It's not fun.
No. You got more stuff?
I do, a little bit, yeah. The weirdest thing that I found with this back then was one of the most effective ways was to just completely ignore the patient who was showing these symptoms, and that would kind of, for some reason, fix that. But they would also ignore certain parts of the symptoms one by one, slowly, quote-unquote, getting rid of it, because, this example, they would ignore the hysteria and focus on other symptoms, and in turn, this caused the patient to feel the need to not produce the symptoms because they are starting to realize that the disease isn't real.
It's a weird take.
Yeah. Well, I know that, in the 50s, one of the earliest asylums where people were put in was in 1874, Ridge's Mental Institution in Ohio, which only just closed in 1993. Mm-hmm. They started out with 200, which increased to 2,000 patients with only 500 to 600 rooms. They did lobotomies, which would take the transorbital out. It was very popular in the 50s and 60s, along with water treatments.
Is that basically waterboarding?
I want to say it can be part of it, but I also think it's where they would make them be in ice, baths.
So just various types of water torture, basically?
Kinda, yeah. And then they started out treating with a medication called Thorazine, which I knew someone that was on that medication, and let me tell you, it was horrible, like drooling, like consciousness, and
so
they still use it today.
It's kind of like a sedative.
Well, it's an antipsychotic. It's known also as chlorpromazine. And it also has like side effects like opioids and lithium, and so it's almost like it was just
it's given, like poison.
Pretty much, it was just given to patients so other people didn't have to deal
with their
symptoms, disorder, diseases.
Well, one of the first recorded cases, you mentioned something dating back to what,
1791?
91. This one was well documented. It was this French guy, Louis Vivet, something like that. Vivet. That's a cool last name. I like that.
Sounds like a Babette.
Babette.
Beauty and the Beast. Sorry.
All right, I'm done with you.
Or Raggedy Ann and Andy in the 70s. Babette was the doll.
Oh, yeah.
So this guy was born to a prostitute on February 12th, 1863, and was severely neglected as a child, which...
From a prostitute, you wouldn't really expect nothing less.
That's weird. You never hear of, like, prostitutes actually having children, but I'm sure.
Oh,
they have them all the time,
definitely hear about them.
Yeah, I guess I'm not much in the prostitution world.
Well, me neither, but they go out to make money to feed their families or feed addictions or whatever. It's not like it's something people usually want to do. I don't think anybody grows up and be like, hey, I'm going to be a whore. Well, okay, let's not get into that.
So
anyways,
singling people out that we know.
Yes, exactly. This one and this one and this one. I went to high school with these 8. So this child at 8 years old had already started like stealing and living a life of crime. So that's good stuff. And like we mentioned before, it's usually before age 6 where trauma starts, where you start developing the dissociation patterns. But this young child was arrested and kept in a treatment house into his late teens. Which, can you arrest small children? I mean, I suppose at that time...
If they're committed or whatever. Yeah. I mean, was it actually like a jail?
It was yeah.
Oh, yeah.
It was like a juvenile house kind of thing. Anyway, so when he was 17, he was working in a vineyard, and a viper, gross, wrapped itself around his arm. It didn't look like the viper had bit him, but he was so terrified that he made himself paralyzed from the waist down. And he couldn't move, and he started having convulsions. And it's weird. I've never heard of that.
I've never heard of that either. That's weird.
So then he was housed in an asylum where he started walking again after about a year, but he seemed to be a completely different person. He didn't recognize people that he knew well. His mood was darker. Even his appetite and like the foods that he liked was completely different. So they released him. And then over the next several years, he was in and out of the same hospital. And during a stay between 1880 and 1881, he was diagnosed with multiple personalities. The doctor that diagnosed him used hypnosis and metallotherapy. I've never heard of that, but it's essentially you place magnets and different metals on the body, like all over.
Oh, they do that now for like pain and like the magnetic bracelets and different things. Yeah, it's obviously different than that, but
yeah. So, and then this doctor said that he discovered up to 10 personalities, but other doctors reviewing the case years, decades later, said that it was more likely that there were only 3. So, not well documented, but one of the most documented, or one of the first documented, well, thoroughly documented words. Help me.
Yeah. Well, the average amount of others, alters, parts, whatever, people prefer different names to, you know, the average is 15.7 alters.
Really?
I mean, you have to, obviously, for a diagnosis, you have to have at least 2 distinct personalities.
Right.
And trouble remembering different events, and, you know, more symptoms of DID, trauma, history, whatever.
Yeah. So, should we get into questions now?
Sure.
Okay. So, Mom, first off, how many identities do you have?
I have 8 known.
8 known.
We have, in one of my last therapy sessions, which I've been going to the same therapist for 8 years, and she's absolutely amazing. Kelsey's met her, you know, like, she's
really nice.
She's just awesome. But recently there's been some different things going on, and so she thinks that there is a 9th, and so we're going to try to meet that person on my next session, which is this coming Tuesday. So possibly 9.
How does a therapist bring those out?
Well,
it
also depends on the
triggers
patient.
Or
there's certain questions. Some people, she has actually brought out some of my personalities. Right. One of my personalities talks with a southern drawl. One of that is absolutely, because you know I cannot make voices or talk.
You're terrible at impersonations.
Exactly. And I cannot say Rin, Kin.
So you can't say like the G at the end of those words?
ONGING.
Mm-hmm.
And one of...
And that's just you. That's not
me.
any of your alters.
I'm guessing it's most of them, but there was one when we were talking and that person, that other could say it perfectly.
Yeah.
Wow.
So and my therapist was just like, we got done and she's like, you can say those, you know, the ING, the ONG, whatever. Mm-hmm. So, yeah.
Okay, so you keep a journal and you've shown me some things in the journal. I think, because you were just talking about how, like, your language is a little different with each alter, but your handwriting is, too.
Yeah.
So, like, because you write a lot of notes to, like, have people do stuff throughout the house, and I can tell which personality it is based on how the handwriting looks. So, that's kind of cool. You don't have to show us.
I'm just looking back, obviously, but this was...
Oh, wow.
Yeah, so, like, this is...
That's Susie.
Yeah. So, and Susie is one of your child alters.
Yes.
How old is Susie?
Susie's 4.
Susie's 4. So, that's the handwriting from... Isn't that...
That's crazy.
Yeah. That's cool. I don't know. So...
I'm, trying to write the ABCs.
What other things can you learn from the journal?
Some of the things that are written in there are not always very nice. Some of the things that are written in there are flashbacks that I have no memory of, and then I'll remember it, so I have to write it down. When you have a flashback, it completely brings back body memories, feelings like you were above yourself, kind of watching what was happening to you. I don't know. But the one thing that you asked before was a therapist can sometimes actually call out different identities if
like
they
by
feel,
name?
Yes. if those identities feel comfortable enough, they will come forward.
So they can just say, "May I speak with Susie?" Maybe.
Yes.
And then.
Yeah.
Oh.
And
that's pretty cool.
It's also where like, and when it happens, I have no recollection of what we talked about, and then we sit down and she reviews it. She brings me back and she's like, "Okay, I'd like to speak to Brenda now," and brings me back and then tells me, and I'm just kind of like, it's okay. And a lot of people with DID can hear all of their personalities.
Mm-hmm.
I cannot necessarily hear them all, but it is constant chatter in my brain.
Yeah. That was another question I had. Do identities typically communicate with each other?
There's a few of them that do.
How does that work? Is it, because everything's in your brain, essentially, so just the information is accessible to certain
Well, and
identities?
They all serve their own purpose. Some of the identities will be small children, some will be teenagers that are, like, anxious and going through all the stuff that teenage or tween people do. Sure. You'll have, like, older teenagers, younger, adults. There's always like a protector. There's like one that has intense survival skills. There could be one that's completely horrible and does horrible things. It just depends on
the individual.
Yeah.
Are you able to tell when you switch? I know you have no recollection of when you are in another identity, but can you tell when it's happening?
Usually what happens for me is, like, I'll get, like, a headache. I'll start getting kind of a headache. Mm-hmm. My anxiety level will go up, and I'll just kind of feel like it's just really hard to explain. It's just almost feel like I'm almost like starting to like disappear.
Okay. Is it kind of like the feeling you get when you're drifting off to sleep, maybe, or?
Well, kind of. Everyone disassociates every day. Some people can be driving and all of a sudden, oh, wait, wow, I can't believe I'm already at my destination.
Yeah.
Like, there's different forms of dissociation, so
yeah. And I mentioned in the first part before the break that everyone dissociates differently.
Right.
It really is. A lot of things are very specific to the individual.
Right.
Well, and there's 3 different types. There's a dissociative identity disorder, depersonalization disorder, and dissociative amnesia, which in my opinion, they're pretty much almost all the same. Mm-hmm. That's just how it is for me.
There's different aspects, but they can easily be combined into one individual kind of thing.
Yeah.
Yeah.
And sometimes alters are not even allowed out. I have one that has not technically, I think maybe in the last couple years she's been out a few times. But other than that, she's not been able, it's like she's just not allowed. And all of the other alters also, that was my stomach this time.
Oh, it sounded like a dog barking in the distance.
I know.
I was scared.
That was my stomach. And then, so all of my other alters basically do not let her out.
Why? Is like
is it like part of the protector alter that's like, I don't want you to come out, or
her name is Sammy. Her name is Sam, and she has done some very unmoral, like bad decisions, self-harm.
I remember when Sam used to come out.
Yeah, it was not pretty, and no. I remember I have had flashbacks. I think even one time you were there at Staples when I came in, and I even said F you to Kelsey in the store.
Yeah.
Oh, I remember that.
And I had no recollection of that until like a couple weeks later. Basically, it was like, it was kind of like I remembered saying it, but then
you didn't remember
the
details.
Right.
Yeah.
I remember that because you came back behind the counter then. You're like, everything was fine, and all of a sudden she just yells "fuck you" at me and walks out.
Yeah.
Yeah.
Yeah. So
everything's fine.
So Sam actually has an alter ego herself named Sammy. Mm-hmm. And Sammy is like the protector. She like still likes to have fun. She can be a little, out there, but she is like basically the only one really blocking Sam.
Yeah.
So do you have like one primary alter that comes out more often than the others?
I'd say the kids.
Yeah.
I think the kids come out.
It depends on the situation. When I get really excited about stuff like going to the zoo, just different places that we've gone to.
There are certain specific triggers too, like a spicy scent that will bring one of the kids out.
Yeah, that brings one of the kids out, and also it brings out Sam too as the protector part, because when I smell a certain spice, like...
Yeah, well, one time we were at the mall in Madison, and we were in Bath and Body. I remember that. And then there was a spicy scent that you were familiar with, and then you were a kid. I think you were Susie.
Yeah.
I'm not sure, but because I remember you had to go to the bathroom, so I took you to the bathroom, because it is kind of like, it's like watching a small child.
Right.
So I took you to the bathroom, and when we washed our hands to go, it's like you'd never seen a hand dryer before. You were playing with the air underneath. Oh my God. And you were giggling, and you were scared of it at first, because you put your hands under, and it was one of those automatic ones, but you had seen me do it. And you threw your hands back to your chest, and you looked at me like this. You were so scared. And I was like, no, it's okay. Like, it'll dry your hands. And then you had so much fun playing with the air coming out.
Wasn't that the day, though? Like, weren't we at the mall for a while after that?
No, because we left after the bathroom. That was on the way out. Because I knew you had switched. So I was like, well...
time to go.
Yeah, we'll take her home. So then we left. Oh, that's the dog shaking. We're going to take a quick break and make sure this dog is fine, because he's bothering us. You don't want to hear his panting on the recording. So we will be right back. All right, thanks for sticking with us through that break. I had to feed those dogs. You got to be nice, because they were pissing me off. Okay, so what are the names and ages of your alters?
I have Susie, who's 4. Jesse is a boy. He's 8. Susie's a little scared, sad little girl. Jesse is a scared little boy. I have Penny, who's 8. She's hurt. She's childlike, more intensely almost than Susie to a point. Annie's 13. She's anxious. She's a teenager. She hates everybody.
Same.
Brandy's carefree. She's kind of a caregiver. She's fun, but she is also a 17-year-old, so I shouldn't need to say any more than that. Sam is a protector caretaker. She's 25. And Sammy, the wild, reckless, rowdy, inappropriate,
violent.
Little
violent.
Liar, cheater, thief. She's the one that's not allowed out anymore. She's in a little box far in the back.
Yeah.
And then Laura Hill, who is 30 and a proper lady who OCD approved, like, oh my gosh, that's so unladylike.
Yeah. I love her handwriting. I already said this, but it's like yours, just more sophisticated. Little loopier, nice.
A little loopier?
Yeah, it's nice.
Yeah.
I like it.
And she's so there's so many different dysfunctions that each alter other has, and she has like I said, she's a prude, and she also has like what is the word that I saw before, and it was like, oh my god, that's definitely her, like basically just like sex is disgusting, like sexual dysfunction.
So Ed Gein's mother.
Shit, I don't know about that.
Are you ever co-conscious about any of the situations? Like, you're kind of just off, Brenda's just kind of there observing while the altar's out?
Sometimes I'm like, I can be like above, but mostly the times, like, I remember being one of the altars and like feeling like I was floating above my body, like watching things that were happening to me or happening around me or whatever, but I have not been able to necessarily master talking to any of my alters, where I know a lot of people do have, like I said, I can hear them, but I can never seem to
discern what each one is saying.
Well, no, I can't seem to have interactions with them or discussions with them. Okay. I can hear the chatter, but I can't, I don't know.
Yeah.
And I know many people that do have DID can communicate with the others.
Because you're in a DID support group kind of thing.
I am in a really awesome group that I've been in for, I want to say, probably 7 years. But there are many, many different groups. There's many different, articles and different, like, support groups out there for DID that are very informational and helpful, and the general population of DID is like 0.1 to 1% of the whole population in the world, which to me, I'm like, no, I think it's much higher than that.
Well, because it can go undiagnosed for someone's entire life.
Yeah, I was not diagnosed until I was 35.
Yeah.
So, and I do have friends from like elementary school, or like when I was like 11, 12, 13 that knew and witnessed me change but didn't know what was going on, or
I mean, that's something that kids aren't going to be able to understand.
It would just be like, oh, Brenda's being a bitch today, or something, or why is she whining, or why is she acting like she's 2, stuff like that.
Yeah. I was going to say what altar is your favorite, but you don't really, you can't.
I don't really, I guess all of them kind of can be a favorite to me, because I think without my brain breaking off into these different altars, parts, others, I would have never survived the amount of trauma that I've had in my life. And, trauma started at age 3 that I can remember, and, has gone on repeatedly through my life.
Yeah.
With relationships, with babysitters, with trusted family members, with just dysfunction in family and relationships in general, in society.
Yeah.
I know a lot of times most times a lot of alters with people are kind of sitting in the present time. Are any of yours like kind of in a past time? Like
I
in
kind
early
of feel like
1990s or
I feel like
anything before that?
Laura is.
She's in an older time.
I feel like she is, yeah. I feel like she definitely is in an older time. Like maybe like the 40s or 50s where you waited on your husband hand and foot and you made his plate and the perfect Stepford wife, the perfect house, did everything. You went to church, like everything that was considered the way a woman should be.
Sure. Huh.
Kelsey, have you ever experienced an alter that kind of came out of your mom and was like, it did seem like they were living in a different time, like they would use phrases from, say, like the 40s or 50s that you've never heard your mom say before?
No, nothing like that. Nothing that represented like a different time period. But when she's the kids, her speech is very, very different.
Okay.
And you're very giggly. It's kind of funny. But like she has a harder time understanding certain words or like certain concepts maybe that are more adult driven.
That Brenda would understand.
Yeah,
okay.
Right. Or like certain phrases maybe. So that's kind of different. But no, nothing from like the different time period. So.
Have you ever thought you were talking to Brenda, but at one point you're like, oh, I haven't been talking to her this entire time?
Oh my God, all the time. That happens like 9 times out of 10.
Okay.
It's hard to know exactly when she switches, but like sometimes like the mall story I gave earlier, like you know that there's a certain trigger and you're like, okay, like she's probably going to switch. Let's just prepare for whoever comes out. And no, but sometimes I'll have like a full-on conversation with her and I think I'm talking to my mom and then a couple days later, I'm like, yeah, we talked about this. And she's like, what? No, we didn't. And then we'll argue about it. And I'm like, no, I swear to God, I told you because I was here and we were doing this. And she's like, I have no idea what you're talking about.
Those are the times that it's scary. But sometimes I feel like, especially like for work, I would say 98% of the time am me.
Yeah.
Like, sometimes I'm able, like, I know that, like, when I was specifically with the little kids, kindergarten and first grade, like, I know that there was times where the little me was just as excited as they were to do projects and stuff like that, but I've never come out in any shape or form as something that was not able to and capable of doing my job.
Yeah. See, I think, like, I think you've gotten better at staying yourself and staying in the present. I already forgot what I was going to say.
Don't look at me.
Come on, you're supposed to be psychic. Just tell me what I was going to say. Shit. You better have a question.
I do, because we're going to touch base on this a bit in part 2 with this in general. But do any of your alters have like health issues or anything different than Brenda?
Yeah, I mean, my body has like a bunch of different autoimmune issues. And it also, some parts of me have just severe crippling anxiety. Some have, the anger. But as far as physical, I think it also depends because there's parts of me that have extreme eating disorders. And there's parts of me that also do self-harm. And so sometimes I wake up and I'll just take a shower, blah, 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 and all of a sudden I'll be like, oh, what the hell happened here? Yeah. You know, it's, I don't know.
I think Sam is the one that does self-harm the most, right?
No, it was Sammy.
Sammy. I keep getting them confused because I think when we were talking about it before, you also had them switched.
Did I?
Yeah. Because which one's which?
I have to look.
When your alter Sammy has an alter.
No, yeah. No, Sammy is the not good one, Sammy? And Sam is the protector, caretaker.
Because I remember way back when you would talk about Sam being the aggressive one, not Sammy.
And that's what we had thought for a couple years.
Yeah, I think that's why I'm confused, because there's two with pretty much the same name. And it is hard to, like, discern who is who sometimes in there.
Yeah. I remember, I don't remember, but I had carved the name Sam on my arm once.
Yeah, I remember that.
That was like 12 years ago or so.
Yeah.
It was like within the first like 6 months of being diagnosed or whatever.
I think that's when it was the most intense.
Yeah.
Because I know you switch sometimes now, but it's not nearly as intense.
No.
As it used to be.
No.
And it's usually to way friendlier alters.
Yeah. I mean, and part of it, I think, back then was that
you were just starting to remember stuff, too.
Yeah.
You were essentially reliving the trauma that caused you to have these alters.
You were 8 years old, and that was a significant time in my childhood, which explained to me later by my therapist that's that age where you were almost like trying to, like, you were growing and I wasn't able to smother you and mother you and take care of you when I felt like you didn't need me. And then all of a sudden,
all these memories started coming back. And then that's when I, self-medicated and did different things that took me. So you're saying it's my fault now?
No. Oh my God. No, it was just that.
I'm kidding. I get it.
9, you were between 8 and 9. That age was just
it was a sensitive age for you.
Yeah. Yeah.
All right. Well, is there anything else you want to say? Do you have any other questions?
No, I don't. That I can think of.
I can't think of any other questions.
We're going to do a part 2 to this.
Yeah, so we're going to have a part 2 that's going to cover some pretty fascinating things. Some super extreme cases of DID. And like I mentioned before, where someone just starts speaking another language that they never learned. One alter is diabetic and needs insulin to survive. The others do not. Very, very interesting cases like that where someone's entire physical chemistry changes when an alter comes out. And we're also going to get into a pretty interesting theory about alters being past lives. So that'll be cool.
Yeah.
And also the portrayal of the entertainment Hollywood industry.
Oh, yep.
There's so many movies, so many TV shows, and...
Let's just do that now. We're already talking about it.
All right. Yeah. Well, okay, so
Split was good. It was a really good movie, but...
It had mixed reviews. There's a whole bunch of... The only part of Split that I thought was really cool was Betty Buckley was the psychologist or psychiatrist. And in the movie, she was in like a computer chat, like in a meeting with people from all over the world, and they were talking about DID and how she explained it. That to me was the best part. yes, I loved it because I love James.
McAvoy,
and he did a
McAvoy.
really good job of portraying, However,
they took it too far.
it was obviously drama. People that dissociate don't necessarily wear different clothing every time they change. It's also like that TV show United States of Terror. Most people that have DID have basically a wardrobe that is basically made of comfort, maybe a couple dressy items, maybe a couple sexy things, but mostly it's, sometimes I feel like I dress like I'm 25, and then sometimes I feel like I'm dressing my age, it's just, but it's not a specific character coming out and say, oh, I need to wear this.
Do you think they did that just for the sake of like the viewer so they could follow which alter it was in?
Yeah. I mean, in terms of film and directing, that was a good move, but it doesn't accurately represent DID.
And there's other movies, Black Swan with Natalie Portman, Color of Night was with Bruce Willis, Mr. Brooks was with Kevin Costner, Secret Window is with Johnny Depp, Fight Club, and Primal Fear, which came out, I want to say, in the early 90s. I loved the movie. I was not diagnosed at that point, but Edward Norton played, but he was a con man playing that he had DID or multiple personality disorder then. Identity, which was a really good movie with John Cusack. Shutter Island with Leonardo DiCaprio, Hide and Seek with Robert De Niro. I mean, there's a ton of movies, but they're very dramatic. There's a few based on true stories. Sybil, Three Faces of Eve, Frankie and Alice, Voices Within, based on Trudy Chase, which I have not really looked into her.
She was mentioned when I was doing some research, but I wasn't able to get into it.
And then they have the TV shows. Last year, this show was on, I can't remember the station right now, Many Sides of Jane. United States of Terror, I never watched. Bates Motel, Do No Harm. Mr. Robot has some DID. And then there's been a couple episodes of Law & Order, which I actually liked. But
I feel like Law & Order will more easily portray, more accurately, I should say, portray.
But even like Betty Buckley from Split, she was in Carrie, the Stephen King movie. She's been in a ton of movies. And this is a quote from her that's on the internet.
So is she an actual psychiatrist?
No, she's an actress. She's an actress. She's a singer. She's, And she wrote, those who experience abuse, suffering, or torture have the ability to evolve into more evolved human beings. It is a response to pain and suffering. They are defined personas to help individuals get through life. And in that movie Split, this man was abused by his mother and ended up having a 23rd personality that was inhumane and a monster. First and foremost, the people I know with DID are not monsters. I'm not a monster. Most people with DID don't go out, kill, kidnap.
Yeah.
It's,
it's portrayed like that in certain films because I think there are so many open-ended questions that can't be answered about it, and that gives this gateway for film producers and writers to just, well, what if this happened?
Right.
Which, I mean, it's cool to think about, but it's not representative of the actual DID population.
I mean, with that itself, is that just like, I kind of see it as a cop-out, like, oh, well, I can use DID as a way to continue the story that I don't know what to do with next. Just give them a new personality, adjust what I have so far, and there we go.
Well, and the majority of the movies are considered horror movies or thriller movies.
Right.
And that's the thing that's just crazy to me.
I think people are scared of the unknown. And, I mean, that's why so many people have, like, well, aliens! They must have done it! Or, like, just ridiculous conspiracy theories, but or they don't take the time to actually be like, oh, okay, so this is what it is. There's still a lot of unanswered questions, but it's not terrible.
Yeah, I mean, it's a mental disorder. It's not anything different than, I mean, depression, anxiety, borderline personality, like, they're all stemmed with it. It was just it sounds crazy to people that don't understand, but it was the brain's way of saving itself by splitting off and protecting parts of the brain, parts of the memory that the body and brain could not handle as one.
So essentially, when you were going through traumatic things, you switched to an alter so that alter specifically would have the memories, but you wouldn't.
Absolutely.
That's intense.
That is.
That's intense.
And when they come back, when you have the flashbacks or you come back and you're like, wow, did that really happen? And then you start remembering more and more and more. And when you do have these flashbacks, you're actually feeling all of the sensations and the memories that you had while it was happening to you.
They're vivid. So when you remember those, are those your alters transferring the memories to you? So I don't know.
How does that work? I'm guessing. I'm not really sure how.
That's a good question.
You know, that's a very good question.
We should have your therapist here.
Right?
I know. I see her on Tuesday, so I will ask her some questions or see if she has any more literature that.
See if she wants to come on.
Yeah.
I
don't know.
I doubt that. Honestly, she only sees patients twice a week, and I don't think she has time.
Yeah.
You know, but I will talk to her and see if she can send me any information that or even if she could write something up to me and, you know, have us sound more like what we know what we're talking about. I mean, we do know what we're talking about, but there's
way more because like we've said a million times in this episode already, it's very dependent on the individual themselves. Everyone dissociates differently. And while there are similarities throughout all the cases, everyone's going to have different memories, different trauma, different everything. Mm-hmm. So, all right. Well,
cool.
Anything else? You guys are good?
Yeah. I think we're good.
So, we're going to...
next time.
Yeah. Till part 2.
Yeah, we're going to do part 2. Dun, 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 dun. That's not the same one.
That sounds like Star Wars.
Yeah. Adam Driver hosted SNL, and he was not bad. He was funny.
Well, okay.
Where did that come from?
Star Wars. He was in Star Wars.
Oh, I've never seen it, so...
In the newer Star Wars.
Yeah, which
I wouldn't even know what you were talking about, because I just remember the original good ones.
Yeah.
And Yoda. Mm-hmm. Yoda. Chewbacca.
Yeah.
I can't even do it. I tried to get the her in there.
All right, we're done. We're done here. So make sure to keep an eye out for part 2. I don't know if we'll record that today or if we'll maybe see if there's more information from her therapist before we do it. I think we'll decide right after this.
Yeah.
So, all right, thanks. Bye.
Bye.